Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about public health, infectious diseases, vaccines, and vaccination. I am Joe Schmitt, and with me, as always, is Dr. Melvin Sanicas. Good morning to Switzerland. Good morning, Melvin.
Good morning, Professor Schmidt. Good morning, good afternoon, good evening to those who are watching us or listening to us today.
The topics we are covering today are monkeypox in Africa, monkeypox infection prevention and control, a very interesting study on saline drops to prevent or reduce the duration of common colds in children. I cover a case of H5 in Missouri in the United States, and I will bring to you some outbreak news from WHO. Let's start with Melvin. Melvin, what is the MPOX update from Africa?
Yes, so we have discussed MPOX several times here, so I think it's just good for us to update people on what's happening. So MPOX cases in the Democratic Republic of the Congo, or DRC, have now topped over 20,000 for this year alone. And in Guinea, they have confirmed the first case, raising the number of affected countries in Africa to 14. This is what was reported by the Africa Center for Disease Control and Prevention last week. As the virus triggers outbreaks in more African countries, of course, it's posing a risk of exported cases in other parts of the world, right? And this was also mentioned by the US CDC in their report. And it's important to note that kids bear heavy burden in both DRC and Burundi. At the briefing, the director of the Africa CDC, Director General John Kaseya, said that the rate of Africa's cases has climbed since May this year, but the case fatality rate is going down because of earlier recognition and care, which is a good sign. But overall, African countries have reported over 5,500 cases, and 252 of them confirmed from 14 different member states over the past week, and over 30 more people have died from infections. So of the 24,851 cases reported in the African region only this year, 22,000 were in the Central Africa, which includes the outbreak's DRC epicenter. And the good news, I would say, is that now there is a plan between the Africa CDC and WHO, a coordinated plan. They have unveiled their MPOX preparedness and response plan last week, which the agency said is a significant step to strengthening and speeding up actions targeting the MPOX threat in the region. And this unified strategy ensures that all partners are aligned on common objectives, on eliminating duplication and maximizing impact. And also, vaccine donations are arriving in the region, and some of them have already arrived as we speak. And so I think these are some of the good news about this outbreak in Africa.
Very interesting. I'm happy to hear there's alignment. I'm happy to hear there is action and that there is common action. And I guess vaccines are only part of it, right? You have to change behavior, you have to be aware, you have to report. So there are many actions around this, and vaccines are one part of that.
That's right. That's right.
Okay. Very good. So we continue to cover that, I guess, in the coming weeks. So I guess, Melvin, the next question then would be, how do you prevent and control MPOX? I just covered vaccines and other measures, but what is it specifically?
Yes, so these are recommendations to minimize the MPOX infection in clinicians, in healthcare professionals, those who are working in the field, right? So one, really make sure that you have the right PPE or the personal protective equipment. Ensure proper use of PPE, including the gloves, gowns, N95, and face shields when interacting with suspected or confirmed MPOX cases. Hand hygiene cannot be overemphasized. Frequent hand washing with soap and water or using alcohol-based hand sanitizer. Isolation protocols, implement strict isolation protocols for suspected or confirmed MPOX cases in designated areas to minimize exposure. Vaccination, we've already mentioned several times also here in Global Healthcast. Ensure that healthcare workers at high risk are vaccinated with either the Jynneos or the ACAM 2000 vaccines, particularly if working in high risk settings. It's also important to have regular disinfection of the surfaces, equipments, and spaces that may come into contact with infected patients using appropriate cleaning agents. Again, training and awareness. It's very important to provide training on recognizing MPOX symptoms, transmission risk, and proper infection control measures to all healthcare staff. And this is something that maybe is sometimes forgotten by people, but the use of disposable equipment is very important. Using single-use or properly disinfected medical equipment when treating suspected or confirmed MPOX cases is very crucial for infection prevention and control.
Yeah, you have the measures on 2 slides. And so if you want to repeat it, or if you want to have it summarized.
For the next slide, it's basically for everyone, for individuals in general. So the first one was really focusing on those working in the field for healthcare professionals and doctors. But this second slide is really recommendations for individuals to limit the spread of MPOX infection. So again, avoid close contact with infected persons or animals showing symptoms of MPOX, rashes, lesions, practicing good hygiene. Again, whether you're a healthcare professional or not, regular hand washing with soap and water or hand sanitizer. Of course, avoid sharing personal items. So this includes beddings, towels, utensils with others, especially those infected or suspected of having been infected with MPOX. Practicing safe sex, right? By using condom and limiting sexual partners, staying informed about local outbreaks in your region and following public health guidance. And last but not the least, for MPOX especially, seeking medical attention if you notice symptoms like rash, fever, or swollen lymph nodes.
Yeah, and we'll put this in the show notes. You can read it as on the PDF then. Yeah, thanks for summarizing this, Melvin. Very helpful. And maybe to mention, vaccine effectiveness is not 100%. So even if you're vaccinated, you should apply preventive measures, right? It's not, let's say you're vaccinated, you can do what you want, but you still need to be cautious.
That's right.
Very good. Melvin, you have another very exciting story on Saline to reduce the duration of common cold in kids. Can you tell us the details here?
Yes, so there is this new research from a randomized controlled trial presented at the European Respiratory Society, ERS Congress, which is still happening now in Vienna, in Austria. The study suggests that simple saline nasal drops can actually reduce the length of the common cold in children by 2 days, at least 2 days. So the authors also said using saline nasal drops can reduce forward transmission. And it's really good to know that, right? It's reducing the days where kids have symptoms, but it also reduces forward transmission. And the trial included 407 children aged up to 6 years who were either given hypertonic saline nasal drops or the usual care when they developed a cold. Of the 407 children, 301 developed a cold. For 150 infected children, parents were instructed to apply saline drops to the children's noses, 3 drops per nostril, a minimum of 4 times per day, until they felt well. And the other group of children, they had usual cold care, which does not include the hypertonic saline nasal drops, right? And there were fewer household reported family members catching a cold in those kids who were given saline drops versus those kids who were not given a saline drop. So basically, the key message is that using saline drops reduces the days when children have symptoms of common cold, and it also reduces forward transmission of the virus. So I think it's something good.
It is very, very interesting. Would you happen to know how hypertonic the saline nasal drops were. Was it look, your regular saline or physiological saline is 0.9 percent. But what would the hypertonic be? Twice that much or 10 times? Would you happen to know? Maybe they didn't
It's
say it.
They didn't say it. It's
Okay.
just hypertonic saline drops. So basically, it's. I guess it's safe to assume that it's like the usual hypertonic saline drops that you can buy from the pharmacy.
Okay. And what was the placebo? Is the regular care, is this epinephrine nose drops or no nose drops or
Nothing.
simple
No nose
water?
drops. No nose drops. Just nothing.
Yeah, but then it cannot be double-blind randomized.
Yeah. So it's just water.
Yeah. Okay. Just water. Okay. Yeah, I guess we come back to our audience once we have read the paper. I guess they would submit it for publication, and then let's look for the paper. It sounds very, very interesting, and I
I think
guess
it will be published after ERS.
yeah, yeah, probably, yeah, yeah. Very good. Melvin, I have a human bird case in Missouri, and the story is it is the case number 14 of H5 reported in the United States in a human. And it is the first case of H5 without a known occupational exposure to a sick person or to infected animals or to a sick animal. So we don't know where the guy or I don't know if it was a guy, where the person got the disease. So what we know about H5, and we reported that before, there is an outbreak ongoing in the United States in cattle, but that has not been reported from Missouri. No herd in Missouri has been affected so far, but in commercial backyard poultry flocks in 2024. Again, H5N1 bird flu has been detected in Missouri in wild birds in the past. The specimen from the patient originally tested positive for influenza A, but negative for seasonal A virus subtypes, and this is why they did the additional testing according to their testing procedures. There has currently been no sign of unusual influenza activity in people in Missouri, so it looks like this is a single case to date, and again, we don't know where the infection comes from. And the N of the H5 virus subtype has not been identified yet as we speak. At least I checked yesterday, and they did not know yet what type of N it was. It was N1 or N2 or whatever. Probably I would expect that it is N1. So I don't want to say it comes closer, right? But I start worrying a little bit more about H5N1, and I would really start worrying about it once we see H5N1 plus H3N2 or H1N1 seasonal influenza will occur at the same time. Once the annual epidemic starts, the question is if the two viruses reassort and come up with a new virus that is an H5 virus, a bird flu virus with some properties of the seasonal influenza virus. So this is what everybody's afraid of, I guess, at this point. Any views, Melvin, on this one?
Yeah, I think experts in Missouri are also looking at the possibility of exposure to raw milk, right? Because raw
Yeah.
milk sales are legal in Missouri, but only directly from farmers to consumers. But I think the main priority right now is really to see if there are any ongoing transmission. But we can safely still assume, I think, that the risk to the public, the general public in general, is low.
I'm covering today WHO disease outbreak news or DONTs, and maybe we do this in the future every once in a while. Nice website. If you have an opportunity, go there and check for it. So the first piece that I want to cover is Vietnam. The Vietnam National Focal Point for International Health Regulations, NFP for IHR. They reported a laboratory confirmed human case of infection with swine origin influenza A H1N1. It's a variant virus from, I guess, the pandemic we had in 2009-10. And this case occurred in the province of Son La in the Northern Mountains province in Vietnam, close to the Lao People's Democratic Republic. So there is more than H5N1 around. And the second piece I want to cover is here from Cambodia, an H5N1 case that is laboratory reported from Cambodia. And again, it has been reported by the National Focal Point for International Health Regulations, NFP. They report such cases. So this was a case of influenza A H5N1 virus clade 2.3.2.1c. And it occurred in a 15-year-old child in the Kingdom of Cambodia. And it is one of 10 human cases of this virus subtype reported in Cambodia in this year alone. And from 2003 to today, 72 cases of this variant virus have been reported, including 43 deaths. And this gives you a case fatality rate of 59.7%. Melvin, any question to influenza so far?
I think it's good that these information can be seen here and compiled by WHO, because we are not aware of all these things happening, right? And it's always not covered in the news, as you know, right? So
yeah,
it's good to once in a while check this disease outbreak news or DONS in the WHO website.
Melvin covered MPOX, and this case in Sweden is related to the outbreak in Africa. And I'm covering one of my recent favorite viruses, the Oropouchi virus. We covered this in our news before. So this is a disease, or it is a virus that is transmitted by midgets, Culicoides paraensis. I've never heard of that before, but this is what it looks like. And it is known to occur in Latin America. Some countries have identified fatal infection and potential vertical transmission of the virus from mother to the unborn. As of 20 July 2024, more than 8,000 confirmed Oropouchi cases occurred, with 2 deaths. And they have been reported from the region of the Americas across Bolivia, Brazil, Colombia, Cuba, and Peru. In Brazil, there was 1 fetal death and 1 miscarriage in the state of Pernambuco. And there were 4 cases of newborns with microcephaly, possibly related to the Oropouchi virus infection. I think what we see is that people now start realizing and detecting this virus as there are tests around, and you probably will see more cases in the future. I don't know if there is really an increase of cases all of a sudden, or if there is just more testing available in the past weeks and even months. The possible reasons for the spread of this Oropouchi virus before its historical range in the past include climate change, deforestation, and maybe unplanned urbanization, and they may have facilitated the spread of the Oropouchi virus to non-Amazonian states in Latin America, and particularly Brazil, and to countries that had not reported cases before, like Bolivia and Cuba. So keep that in mind. Oropouchi virus may keep us busy in the future. And Melvin, maybe you have a view here on Oropouchi.
Well, just like other mosquito-borne diseases or diseases that are transmitted by insects and let's say smaller animals, I think we should just be ready that we will see more of these things as a result of global warming, right, and climate change, because now these insects are able to be in places where they were not able to live previously, because it was either, I would say, too hot or maybe too cold for them. But now they can live in these places that are new for them, new for us as well, but it's bad for humans.
Yeah, good point. Let's move on to India. And you probably have not heard about the Chandipura virus. I had not heard of that, but it may cause acute encephalitis. And actually, between June and mid-August 2024, the Ministry of Health of India reported 245 cases of acute encephalitis, including 82 deaths. And of these, 64 were confirmed cases of Chandipura virus infection. Chandipura virus is endemic in India, and outbreaks have occurred in the past regularly. However, the current outbreak is the largest in the past 20 years. The Chandipura virus is a member of the Rhabdoviridae family, and it is known to cause sporadic cases of outbreaks of acute encephalitis in western, central, and southern parts of India. It is transmitted by vectors such as sandflies, mosquitoes, and ticks. The case fatality rate is between 56 and 75%. There is no specific treatment. So I think this is very important to know about and to get to know a little bit more why it is increasing and why these outbreaks occur. And I'm tempted to say that may again have to do with climate change, but again, we cannot blame everything on climate change. Maybe one person or several people in the audience can help us to explain why Chandipura virus is all of a sudden causing a large outbreak in India. Any view from your side, Melvin?
Definitely, climate change is one of the issues, but I guess again, urbanization. Also, we mentioned here earlier, if we are destroying forests or traditionally areas where these insects or animals live, then of course we are bound to suffer these consequences too, right?
Yeah, yeah. I skip over dengue in Iran. I skip monkeypox in South Africa. We had covered that in the past. I also covered influenza A, H5N2 in Mexico in the past. And there is now an update on human infections by this virus. There was a confirmed case of this in a patient with underlying comorbidities, and he subsequently died. I think this information we did not have at the time we first reported about this. And again, it is a case of H5N2, not H5N1 in the United States, H5N2 in Mexico, in a patient with an underlying disease, but we don't know where the person got the infection. We don't know where it comes from. The patient apparently died due to complications related to comorbidities. And again, this is an interesting piece of information that has now been released as an update. Finally, I cover again avian influenza. This time it is H9N2 and it is India again. And that strain, that subtype was detected in a child living in the West Bengal state of India. And it is the second human infection of avian influenza AH9N2 notified to WHO from India. The first case had happened in 2019. The child recovered and was discharged from the hospital. And I guess most of these influenza AH9N2 cases have been resulted from exposure to the virus through contact with infected poultry or contaminated environment. And again, to date, to the best of our knowledge, there is no human-to-human transmission. Usually, H9N2 cases are relatively mild. So there may be more such cases around spreading in India as they are mild and probably are not detected because nobody is doing the test. And that covers all the tons that I had prepared for today. Melvin, any views from your side?
This is really a good overview of what's happening out there in the world because it's not all MPOX and it's not all H5 influenza. There are others.
Yeah. And I guess it happened in the past, but nobody ever took care of it. Right now, WHO has a reporting system and countries are obliged, they must report these cases. At least they are required to. They signed the contract and apparently they do. And this is good news. And now all of a sudden we know what is going on. With that, we come to a close. We We spoke about MPOX update in Africa and the official launch response plan from African officials from the Africa CDC. Melvin covered infection prevention and control for MPOX, things you can do as medical staff and as a private person, as a not patient, but as a lay person. Melvin covered hypertonic saline drops that reduce the duration of common colds in children. I covered the H5 case in Missouri without known source of the infection. And then we had today disease outbreak news from WHO. And with that, I can come to our last point, which is I've got 99 problems, but diphtheria, tetanus, pertussis, meningitis, hepatitis B, polio, measles, mumps, rubella, varicella, pneumococcus, meningococcus, and more are not among my problems. So with this, I hope you have a very good week. See you again next week. Melvin, you have the last word.
Yes, I just hope that people realize that all these diseases are vaccine preventable. There are vaccines for all these diseases that Professor Schmitt showed here. So I think that's the message, and I hope people got that. So thank you, everyone. Stay safe.